Hi everybody, it's Dr. Tenenbaum. Monday afternoon, 12:30, I am going to be speaking with you today about fat transfer. We specifically have been doing a series on facial rejuvenation, so we will discuss fat transfer in reference to facial rejuvenation. However, as many of you probably are aware, we use fat all over the body, and fat grafting or fat transfer can be a very powerful tool for us in breast surgery, aesthetic as well as reconstructive, augmentation of the buttocks or other areas of the body, contour, correction, sometimes after a liposuction, etc. But specifically, fat grafting has been used to enhance facial rejuvenation for a very, very long time. The way that fat grafting works is we use liposuction techniques to harvest fat. Depending on the amount of fat we need, sometimes we only need a small amount, sometimes we can use a little more, or sometimes you may be undergoing liposuction anyway, and we want to use just a portion of that fat for grafting. So typically this is something done in the operating room. If it's done in the office under local, that's typically a smaller area. But in the operating room, often by itself or in conjunction with other procedures such as facelifting, neck lifting, eyelid surgeries, brow lifting, etc. Fat transfer can be used to enhance that result. So we harvest the fat with liposuction. Many different techniques of liposuction can be used to harvest fat. So I personally typically harvest my fat with standard power-assisted liposuction. So that's a tumescent technique where tumescent fluid is injected first. The tumescent fluid consists of a liquid, and then we add to it epinephrine or adrenaline, which helps constrict blood vessels so that we don't get very much bleeding with the liposuction. And then a numbing medicine called lidocaine so that the patient doesn't experience as much discomfort. And then if the patient's awake, we'll also usually add something to it called bicarbonate so that it doesn't sting going in. Then we harvest the fat with the power-assisted device. Some people may use other systems like a water harvest system or an ultrasound-assisted liposuction, etc. All of these can be used to harvest fat. It really just depends on the patient's preference. Then the fat is processed, and here's where fat grafting can get very tricky and confusing because the truth is there's lots of different ways that fat can be processed. And we're still in the midst in our field of really trying to figure out which methods of processing really are the best for managing that fat. Processing of fat can be as simple as very minimal processing, meaning very little is done to it and it's re-injected. Sometimes we wash the fat with saline or salt water or other solutions to try and wash away any additional debris or any blood or tumescent fluid that came out with the harvest. Sometimes we will use a centrifuge to spin down the fat and concentrate the fat more so that when we inject it, we're injecting less saline or less other fluid, and it's a more concentrated fat product. Sometimes the fat is, like I said, filtered and washed, and there are multiple different systems that use that. Sometimes the fat, we want to keep it a little more solid, and so we might simply roll it on some gauze to try and remove some moisture, but leave it in a more solid form. Sometimes we treat the fat by emulsifying it, and we call that nano fat, where the fat really loses most of its structure, but we think that this nano fat can have positive properties for enhancing the skin. So for example, the nano fat we can inject in the more superficial layers of skin, and we're using some of those growth factors that are in the fat to help rejuvenate and thicken collagen in the dermis, etc., and rejuvenate with growth factors. And we think that in a lot of patients, this can give a really nice improvement in texture and glow to the skin, but isn't really adding volume. When we want to add volume to certain areas, typically we're not using nano fat, we're using a more solid form of that fat to actually add volume and structure. So then how do we use the fat once we've decided how we're processing it and we process it in the operating room? We use blunt cannulas, so they're not really needles, they're cannulas with not a sharp tip, but a blunt tip on the end. And we inject that fat into different areas. So for example, you guys have heard me do the talks on fillers and volume enhancement of the face. The fat is exactly the same. So we use fat in the entire face, temples, under the eye in this hollow here. Cheeks are very common. This area supporting the nose, as we lose that structure, this can sink, and so supporting the nose as well as nasolabial folds, lips, jowling areas, those areas are all used for fat. And guess what? Even earlobes. Sometimes we enhance earlobes if they start to thin out or droop. The fat, exactly like we talked about filler. So why would you use fat over filler? Well, the truth is they're both excellent, and for a lot of people, they may use a combination of both. My typical treatment algorithm is if I'm going to be in the operating room doing a facelift or a neck lift or an eyelid lift or a brow lift, I'm already there. Almost anyone can benefit from some added volume. And so adding fat transfer to those procedures is very common in my practice and in my hands. So I will add fat to those areas or wherever I think the patient can use it. The nice thing about fat is that it's your own tissue and it can be permanent as opposed to fillers, which can go away or dissolve with time. The downside to fat is that we know not everything we inject is going to reestablish a blood supply and live. So whatever we inject, we know a certain portion of that is going to go away. And unfortunately, that is not entirely predictable. That's going to be really different from one patient to the next. So it's impossible to tell the patient exactly how much volume correction they're going to get with one session of fat grafting. So what is common is to do a session of fat grafting in the operating room, especially if it's in combination with other procedures. And then if they still need more volume, usually around 3 to 6 months from the procedure is when I feel we have the final correction in terms of what is going to survive and live with that fat grafting. Sometimes they may want to do another round of fat grafting in the operating room, and that certainly can be done. Or sometimes if there's areas that we still want to augment, go ahead and do that with an off-the-shelf filler. The off-the-shelf fillers can be a bit more predictable in terms of how much volume we're going to get, but again, we know they're not going to last forever, and so it's something that we have to repeat over time. Fat grafting is an excellent, very powerful addition to a lot of aesthetic procedures we do. Specifically with regard to the face, it gets back to one of the main culprits of facial aging, which is loss of volume and loss of structure and support. So adding back that structure and support in the form of volume and using your own fat is incredibly powerful. So we use it all the time and we love it. So I hope that this was helpful. Since we have a little bit of extra time and I happen to be on my phone today, I'm going to show you my staff right now. So they kind of shut down the office at lunchtime because they're doing their little holiday, like white elephant gift exchange. So we're going to just like peek in on them in my waiting room. Say hi, everybody! Merry Christmas! Happy Hanukkah! Aren't they the cutest? So cute. Okay, while they're enjoying themselves, don't forget about Elastin this winter. Once you have your fat grafting procedure to your face, you'll want to keep up your skin. Hi! There goes Jen. She's missing the party. Okay, so hopefully you found this informative, and if you have any additional questions or you want to leave a message, that's great. We will answer it. Or if you want to make an appointment to see one of us to talk about facial rejuvenation, this is, I think, the end of my series on facial rejuvenation. So if you want to talk about any of the things we've discussed, fillers, neurotoxins like Botox, lasers, resurfacing, skin tightening with Ultherapy, fat transfer, or surgical procedures like rhinoplasty, eyelid lifts, brow lifting, face and neck lifting, augmentation with fat, any of those things, please give us a call and make an appointment. We would love to chat with you. Thanks, everybody. Have a great rest of your Monday and have a great holiday week.